One of the coolest things I think about epigenetic orthodontics is that we can now go into adults who are full grown and go back and stimulate growth factors within that bone to now grow bone in adults that are not are fully grown, that have no growth ability left. The reason that that happens is that the bones of the upper jaw are underdeveloped. So the growth factors that are there to guide the growth, they still exist. So we're going back through and changing the expression of those genes to release the growth factors to now grow the jawbone back to what your genetic blueprint should have been had you not had corrupted development as a child. An interesting pattern we see often is that most of our patients that we treat as adults have had teeth extracted as a child and orthodontics done at that time. That's a really, really strong indicator of the fact that the upper jaw had not grown enough. So rather than address the foundation and grow the upper jaw, treatment had just removed teeth to make them fit into a smaller jaw. The problem with that now is that the tongue doesn't have enough space because it's a smaller area than what was genetically designed. When the tongue gets compressed, then that pushes it back into the airway. As the airway gets compressed, breathing becomes more difficult. The body's way of dealing with a compressed airway is to position the head forward. So we'll typically see head forward postures in those patients as well. The interesting thing is that as you correct the bone and we regrow it back and recreate space, the tongue now can fit in the mouth, and as the tongue starts to fit in the mouth, the airway opens up. As the airway opens up, the head goes back spontaneously up on top of the body.